Hello, welcome to Lecture 7. Lecture 7 is all about selecting a research design. The research design choice goes past choosing um, qualitative or quantitative research. If you've already read Chapter 7, you have a pretty good idea as to the different types of research design that exist. And what this lecture is intended to do is to review all of the different designs for you in a brief manner. Obviously, as we have discussed before, just going through the lecture doesn't exempt you from reading the chapter and answering the questions in the back. Those are essential for your comprehension of the content. It completely depends, your research approach completely depends on the questions you wish to ask and the type of information that you wish to collect. Some questions need deep, rich, descriptive data that you can only get from interviews and narratives. So that means you're going to have to work with either a small group or a small number of people or a very small sample size. Other times, because of how your question is framed, you may want to get some more general information and numerical data. So that makes us decide whether we want to go with a qualitative or a quantitative approach. Qualitative data gets into the personal perspective, into great deals of either individuals or very small groups with specific characteristics. And as you know from before, that it can always be followed up by the other kind of research. So if you start qualitative, you can go quantitative, and if you start quantitative, you can follow up with some qualitative research with a smaller sample to get an in-depth understanding. So if you look at an example of older adults immigrating to Canada, if all we wanted to know is country of origin and education criteria for older adults coming in or financial criteria, we can get all that information from Immigration Canada. Right? But we don't really know the phenomenology behind why some older adults want to stay in Canada. Lots of older adults simply come to visit their families and then return as well. So what are the factors that influence their desire to stay or live in Canada? Is it proximity to family? Is it the roots they have in the home country that make them go back? Is it financial dependence on their children? Is it dependence for other kinds of help? What about culture? What role does culture have? What about the connections and social ties back home? What about the individual's identity, which becomes completely absent when they come to a brand new country? So many factors. If you wanted to study those kinds of factors, you can't pick up data from Immigration Canada. That's something that you get through personal narratives and interviews. This is an example which has been, perhaps is in your textbook. I don't remember if it's in this edition or a previous edition. So Lebow was a white person in the United States, and he wanted to study the impact of poverty on African Americans at the height of the civil rights movement. Recognizing that he didn't have a frame of reference or a structure in which to frame all those individual experiences in, what Lebow did is he went in without any preconceived idea, and he lived in those circumstances so that he could actually develop the questions for the interviews to actually study this phenomenon with respect to the African Americans and their day-to-day life. So the other thing you have to remember is anytime we talk about a relationship between variables, we're typically talking about quantitative research. If we're suggesting there's an independent variable X and it's related to the dependent variable Y in some way, shape, or form, we draw an arrow between the two as we visualize the concepts, and we suggest a positive or a negative relationship. Now, getting into quantitative research a little bit more, this is just an example of a study as it pertains to academic performance. And it's just to take you back, this is unpacking the concepts a little more, making it more operational. So the last animation here is the number of hours spent, which can be measured, the marks on the history exam, which also can be measured. There are different types of relationships between variables, and we might have spoken about this before, but a review is always good. An association between variables is often easy to prove. Good marks are associated with hours of study. But there are other factors, as we have discussed, which are important for good marks. Having the right textbook is important. Having the mental capacity to maximize those hours, hopefully there are no disastrous events, personal events that take up mental space and health in those times. Physical health, physical wellness. All of these factors have to be controlled for to actually make a cause and effect relationship reasonable. For the most part, without that, the relationship remains an association. So cause and effect is very hard to prove, and association a little bit easier. And sometimes two concepts may not be related, so there may be no cause and effect, and there may be no association, and a change in one causing change in the other can be pure coincidence. Okay. Cause and effect is best argued when other variables are controlled. When you think about example of non-causal relationships, calories and weight gain. And if we pick two groups of people and fed them different amounts of calories, hoping to see one group consistently show in all individuals a weight gain due to increased calories, and the second group not show as much weight gain, perhaps due to a lower level of calories, we may find that the result is all over the place because we haven't accounted for, say, a differential metabolic rate between individuals. We haven't accounted for activity level. We haven't accounted for gender. And if the experiment is done poorly enough, perhaps we haven't accounted for the specific type of diet that's being consumed. So it would be a non-causal relationship. Same thing about mental health and stress. Even if we are comparing individuals who encounter a similar amount of stress, we aren't accounting for the support each individual has and the resilience of each person that might be different. Different people will have different coping skills and so on. The assumption is that if people make a lot of money, they probably don't have too much debt. And again, that's non-causal relationship between two concepts. It may not even be true. In fact, people who make more money are most likely to overdraw their accounts by far larger amounts than people who make less money. So you can think of many situations where there appears to be a causal relationship, but there are many things that can confound the relationship itself. So what does research design look like? There are several types of research design that we can use, whether we're studying, whether we're doing qualitative or quantitative work. Often it's easier to think of these different research design in the context of quantitative work because it's easy to frame your research question. But all of them can be done in a qualitative manner as well. So the first example is a case study. The case study asks as to what is going on. Is there a relationship between two variables, x and y, in an entity? Now, a case study doesn't necessarily mean that you study one person or one individual. A case study can be used to study the transportation challenges in the town and so on. The longitudinal study asks if there has been a change in between two variables in an entity at different points in time. So, for example, if we look at, let's say, median income. In Sudbury, and we look at different points in time, 1980s, 90s, 2000s, 2010s. Okay, and obviously this is pretend data, so if you're looking at the change in median income, which would be your y or your dependent, and your x would be the time frame, and we see a rise in median income. So we're looking at the change in one variable in the context of another, and that would be a longitudinal study. A comparison study is different from a longitudinal study in the sense that it's not asking for a change in the dependent variable over a period of time. What it's asking is there a change, is there variation in a variable that can be measured in different circumstances? So, for example, if you think about the same thing, median income, and let's say it's looking at median income in 2020, and you're saying, well, how is it in Sudbury, North Bay, Mississauga, and Barrie? So what we're doing is we're capturing a snapshot at a certain time, and well, I'm not going to put any numbers here because I don't know what the median income is, which I should probably go check. Anyway, the point is you can plot that, gives you a snapshot of what the median income looks like. Okay, and again, this is pretend data, don't take this seriously. So the comparison study is asking for, at the spot, a snapshot of the measures in a certain variable between different pockets of the population, different groups, or maybe different populations themselves. Now, if you're thinking that why can't we combine both and ask a more complex question, well, that you'd be right, and that is called a longitudinal comparison study. There's really nothing preventing one from asking, if we take the median income example, asking, well, how has median income changed in Sudbury versus Barrie versus Mississauga? Well, let's pretend that we drew this graph of median income change in Sudbury. We can use the same graph to plot what's happened in North Bay, and we can say that we represent that graph with dots. It would be a dotted line. And let's say Mississauga has a dashed line or a double line. And Barrie, let's just go with a line punctuated by triangles. So what we've done is we have looked at the variation in the dependent variable, not just at one point in time, but multiple points in time. So this is called a longitudinal comparison study. The experiment is where two groups, A and B, are compared. So let's say we're looking at a drug for Alzheimer's. Let's say I'm going to put this here, Alzheimer's drug trial. And we want to see if this drug is effective in reducing the amount of senile plaques in the brain, the plaques that form in Alzheimer's patients. So we have two groups of individuals who've all consented, or their caregivers have consented to the study, and let's call these individuals A, B, C, D, and these people are called A prime, B prime, C prime, and D prime. So the primes get the drug, and the non-primes get no drug. They get something called a placebo. When controlling for all factors, including diet, physical activity, and exercise, perhaps even gender, maybe they're all females, all males, what happens is after the drug has been administered for whatever amount of time, let's say 6 months, both sets of older adults are put through an MRI or a PET scan. These are different medical scans that can analyze tissues in greater detail. And then you figure out whether one group, this is called a control group because they have not had a therapeutic intervention. This is a test group, whether the test group shows a change in the number of neural plaques as compared to the control group. So this kind of an intervention where you have a control and a test group, this is called an experiment. Experiments can be done in a different way. It doesn't have to be two different set of groups being experimented at the same time. There can be pre and post testing as well. So for example, if we are attempting to measure attitudes, we spoke about attitudes in the last lecture. If we're doing measuring attitudes, let's say we're measuring ageism in employees working at long-term care. And we hand out a survey which asks them questions which don't necessarily suggest to them that ageism is being measured, but they're asked to participate in a survey in order to improve their service delivery. The administration of such questionnaires before any kind of instructions or seminars or sensitization program will lead to a certain set of scores, and they can be matched to scores from the same employees once they've been through some sort of an educational program to see if that attitude approach changes towards ageism itself. So there are multiple ways to conduct experiments. Experiments are more indicative of a causal relationship between the dependent and the independent variable because you're controlling for a lot of different factors. So again, a case study, just a refresher, a case study is not necessarily an individual. It is focused on a single case or entity. So for example, if you want to look at transportation challenges in the city of Greater Sudbury, even though you're studying the entire city, it would still count as a single case because you're using that as a model. With a case study, again, you can go qualitative or quantitative. It depends on what you wish to ask. If you are interested in documenting the challenges faced by older adults who have ceased driving, so let's think about older adults with driving cessation, and you wish to find out their experiences, then it's more useful to go through a qualitative study. On the other hand, if you want to find out what the ridership of older adults is in city transport, then you need a quantitative study. Okay, so it depends on what you're trying to do. Usually in a case study, you don't necessarily look for cause and effect because there's a recognition that it's a singular case, and you may be able to draw out an association at the end of the study, but it's not. You're not necessarily testing a hypothesis, or you're not testing a hypothesis that you created for the purpose of the study. Case studies are often used to test previous hypotheses, previous causal relationships. So, for example, if you discover through a literature review that in larger cities, communities that are more than 15 kilometers away from the city center are likely to be poorly serviced. If that's the result of your literature study, you might be able to use a case study of studying Sudbury to validate the existing hypothesis or understanding. So let's look at an example of a case study. Let's say I have two vending machines at a country club, which is frequented by older adults. Let's say machine 1 dispenses pop and other carbonated beverages. Machine 2 dispenses fruit juices. No prizes for guessing which one is healthier. But a common observation is that machine 1, let's look at what machine 1 does. Machine 1 is the pop. Machine 1 gets emptied more often than machine 2. And why might that be? So is it because older adults make poor health choices? Or is it because machine 1 is at the reception, so it can't be missed, so it gets used, whereas machine 2 is by the restrooms in the back, so it doesn't get frequented as often. Three, does machine 1 simply hold less product? Which means even if all factors were the same, machine 1 would likely get emptied further. So there are many reasons, and this is to be analyzed carefully even in a case study, and the numbers have to actually be thought about quite a bit. Your textbook has a similar example of junk food consumption, but the idea is pretty much the same. So a longitudinal study, as you said, is change in one with respect to another over a period of time. So the time is the second is the independent variable. So we took the example of median income. It doesn't have to be median income. It could be bodily flexibility. It could be number of social relationships over time, number of births over time, number of deaths. It could be weight loss, so on. There could be many factors that change over a period of time. Pre and post testing over time, while it can be done in an experimental context, it can also be done in a longitudinal study. So, for example, if we did attitude testing without any formal measures to educate, if we did attitude testing or ageism for older adults, and you have employees coming in and you had them tested at regular intervals over the period of a year, so this is January, June, July, August, September, October, November. You had them take a test prior to employment, let's say that was in May, and this is a score, ageism score, and this is all hypothetical. It looks something like this. So a longitudinal study can be used to look at pre and post testing or some sensitization over a period of time. A comparison study, like you said, it's a cross-sectional study. If we wanted to look at incomes by age, if we wanted to look at a comparison of all-season versus winter tires, so on, these would be examples of looking at one changing variable at one point in time. The goal obviously is to look at a relationship, investigate a relationship further for its accuracy. Your textbook uses the example of English proficiency and unemployment. So in that case, if you think about it, let's see. So if you made a graph, your English proficiency would be the independent variable. So let's say you have proficiency scores in the 20s. We don't know what this means. These are made up numbers, okay? 30s, 40s, 50s, and let's say 60s are the best. And unemployment. And let's pretend that English proficiency is directly related to or inversely related to unemployment. So if you are more proficient in English, you're less likely to be unemployed. So you look at the numbers of unemployed people, it's quite low if your scores are higher, and their unemployment is pretty high if you are poorly proficient. This is Canada's bilingual. I recognize that. This is not to say that you have to be proficient in English to have a job. We're just using an example to look at a cross-sectional relationship. Okay. So the goal of cross-sectional or comparison study is to investigate relationship further for its accuracy. It's also to look at reproducibility or of results. You can replicate results. So basically, for any kind of research, we need to have obviously variables. We need measures for those variables. We need a way to record those changes. And we need a consistent way to measure. Longitudinal comparison, very simply, is looking at the change. As we spoke about, we had the example of median income in multiple cities. You look at a time period, different years, let's say 2001, 2002, 2000. And let's say tens of thousands of dollars. So let's assume this is you typically have legends, so this would be Sudbury. That would be Barrie. Oops. Let's just take 3 for comparison. That would be North Bay. So this is example of a longitudinal comparison study. It's possible to compare um, median income in 3 different cities at multiple points in time and document them perhaps even on the same graph. And that would be the example of a longitudinal comparison. It doesn't necessarily have to be income, but the longitudinality is a sense of going over a period of time. So this could be median income, this could be number of cardiovascular admissions, and such a situation would occur if the government is trying to understand the expenses on cardiovascular disease treatment between 3 metropolitan areas and thinking of some kind of an intervention. So the graphs would obviously look different, but you can see how you can plot for the same dependent variable over a period of time. As we spoke about, the experiment is a little bit different. You have a test group and a control group and a test group. So we have a control and we have a test. So typically what must happen is, if your textbook has examples for this as well, you have A, B, C, and D, and we can call these guys. We called them previously A prime, B prime, C prime, and D prime, but we could just as easily call them E, F, G, and H. And let's pretend we're testing the efficacy of a diabetic drug. So we're testing the effect of an anti-diabetic. Let's say we call this metformin. And we are going to administer the drug between a control and test group. So we get the baseline for everybody in the control and the test group. So we measure, let's say this is done at 8 a.m. We take measurements, measure blood glucose. It's a relatively simple process. You prick the finger and you measure, and you find each of these individuals has a slightly different blood glucose level starting out, and your factors are determined because you're testing the effectiveness of an anti-diabetic drug. Your requirement for either set of individuals is that they are all diabetic. Because if they aren't, then there's no point in testing an anti-diabetic drug against them. Measure baseline blood glucose. You get the numbers for each person. Then, while this group consumes what we know as a placebo, which means a non-drug that looks like a drug. And then following consumption, let's say 2 hours on, each group is tested again for blood sugar. Let's say this is 10 a.m. And then if the drug indeed works, and this is an established drug, so I can tell you for a fact that it does work, the anti-diabetic group should essentially show no reduction in blood sugar. And there should be a significant reduction here. Okay. So what you're able to do is you're able to show that with your variable is blood sugar levels, right? Your intervention, which is the drug, it causes a change. So then you can establish a causal relationship saying consumption of metformin causes a reduction in blood sugar. And an experiment is the only conclusive way to rule out confounding factors because you can control for several things. You can control for gender, so you can make sure that these are all for males or all for females, and same here. You can ensure that they're all diabetic. You can ensure that they've all had a diagnosis of diabetes between the past 6 months. You can ensure that they consume this exact same food before consuming either the drug or the placebo, and so on. So that's why it's considered to be the most rigorous method of proving a causal relationship. There are ways to conduct experiments for qualitative work as well, but it's in a different context in the sense that it would have to be the same individual with a pre and post intervention situation. So these are the different designs of research available to individuals, and as researchers, there are creative ways by which each of these techniques can be used qualitatively or quantitatively. Okay, that's pretty much it for Lecture 7. Please go ahead, read the chapter, solve the questions in the back, and work on the reflective activities. Use the fun stuff link that's presented in your modules. Those videos are actually very interesting. Strongly recommended that you go through them and complete any assignments or discussions that you may have. All right, we will see you in lecture